Jamie, excess deaths, is it a thing or not?
Well, Mark, it is a thing at the moment, and we talked briefly on it last week where we had the May figures from the ONS, and we could see that deaths were running above average, and that's when you take out all the deaths that the medical practitioner had said that COVID was a part of it. And the latest figures that we've got for June now in the last week, we've seen about 10,844 deaths across England and Wales. And if we compare how many you would expect to see in this week by looking at similar weeks over the period, say, before the pandemic, that's about 1,427 above average. Now, we know that there are still some deaths happening in society which are related to COVID. We had 161 out of those 10,008 odd in terms of the deaths that were due to COVID, and a few, about 103 where COVID was mentioned on the death. So we stripped those out. We've still got, Mark, 1,160 deaths in 1 week alone now, in the latest week in England and Wales, above average, which cannot be explained by anything related to COVID. And the thing is, we've got lots of the mainstream media talking about rising infection rates across England and Wales at the moment, and we know that with this new Omicron variant, they're far less deadly, but it's plastered all over the news. You had Jonathan Van Tam interviewed on the BBC on the week a few days ago talking about these new figures. He was saying, no alarm, he still doesn't wear masks, but nobody's really talking about these excess deaths. We were talking about excess deaths when we were seeing them because of COVID, but it's just as important when you've got these excess deaths for other factors. Now, the ONS, when they publish the weekly figures, don't look at it in terms of cause, but we will get a bit more insight into these, like we did for the May figures. In about a month's time, we'll get a bit more insight in terms of the June figures. And it was heart disease was one of the factors in May. And is it a case of what we touched on last week, Mark, that staying home, protecting the NHS has meant that you've not protected yourself, and we're seeing people dying of other causes because of these long waiting lists and people not getting diagnosed with certain conditions?
Well, as statisticians certainly know, correlation is not causation. Nevertheless, this is a high enough excess death rate, not just in England and Wales, but elsewhere within Her Majesty's dominions, that it's surprising that there's more publicity given to some virtually harmless Omicron variant than an actual health crisis for whatever reason.
No, indeed, because if we're seeing all of you've got your usual suspects in the UK, Mark. So you've got Independent Sage. What that group is, it's a group of kind of people who've come together. They weren't, the government didn't want to listen to them, so they weren't on Sage throughout the pandemic. And we know what some people would think about Sage with the pandemic. So they set themselves up as this independent version of Sage. And they've just constantly been kind of doom-mongering and calling for more and more restrictions all of the time. And if you look at the facts and figures and look at it in terms of, some common, look at it and with some common sense in terms of all this, Mark. In Wales at the moment, we've got 40 patients out of 9,260 beds who are in Wales hospitals because of COVID. If you look at England in terms of critical care beds, at around a quarter of this time last year, they've hardly moved, and there's 52 patients out of over 4,000 beds. But what you see, Mark, is that these people who want to kind of scare the public, with Jeremy Vine putting out videos saying, why aren't the government doing things? Why aren't they locking people down? They focus on the infection rates. Now, a lot of people I know have got COVID, but there's very little wrong with them. In fact, I know very few people who've never had COVID now, in terms of where we are. They focus on those numbers, but do we see the headlines on the front of the newspapers or on the mainstream media about these thousands of deaths that are occurring above average? We don't, Mark. And I think the ONS themselves should be looking at this in terms of the causes of these deaths, because we need to know what's going on, because if there's a common theme happening, we need to address that, don't we?
Well, absolutely. What do you make of these? Again, correlation is not causation. It could just be because people are a bit, as you say, people are depressed because they've been locked down, they've been living alone in their flats and whatever. What do you make of these figures showing significant lowering, fewer births in 2022 so far than there were in the 5 previous years? As I said, in multiple European countries. We may not know what it is, but something's up, isn't it?
Well, yeah, we know over the long term, Mark, that we've been seeing declining birth rates across many countries. In 2021, some countries saw an increase in birth rate. That might have been people locked down, didn't have a lot to do, conceived some babies. But these numbers and the charts that you've looked at, I did look at the German numbers myself a couple of days ago. You know, these are the
Mm.
official figures that are being published by the national statistics agencies in those
Mm.
countries. And you're right, you can't say one thing causes another. But what it would do as a statistician for me, and this is what the government should be
Mm.
doing with their agencies, is it's not good just publishing numbers, because numbers, they only tell you
Mm.
part of the story. You've got to investigate and look into the reasons why. And that's the thing now, I think what's missing. I was looking to see when we get the results in England and Wales. Now, around June last year, we got some figures from the ONS looking at the first quarter of 2021 because they were looking at the COVID pandemic. I can't see any release date for anything there, but I think it would be interesting to see if
Yeah.
we're seeing the same phenomenon in England and Wales. But I think, regardless of the cause of it, whatever it is, people will speculate on what the cause is. There needs to be some investigation and some answers into this so people can be reassured into what is behind the cause of all of these figures.